Well, hello. I'm Richard Branson, and I'm founder of the Virgin Group, and I'm a member of the Global Commission on Drug Policy. The war on drugs has failed, and when I have a business that fails, I shut it down. It is now time to shut down the war on drugs and find a solution building on your successes. Success is when new HIV infections among people who use drugs in Switzerland drop from the highest in Europe to among the lowest. Success is when governments like Portugal reduce costs by introducing compassion and care into their policies instead of locking people up by the millions. These are the right investments for governments to be making. Part of what makes drug policy discussions so difficult is that we're not listening to or respecting the rights of those who use drugs. Hopefully, we will reach a point where former and current drug users can openly talk to policymakers about their needs and about what their experiences tell us of the failure of the current system without fear or judgment. Many of you have been on the front lines of this important advocacy for years, and I applaud you for your successes. I'm excited that this conference is about looking ahead to create a future that once seemed inconceivable. It is about looking ahead to the coming months to when governments like France take the sensible step of introducing facilities that protect people who use drugs from fatal overdose. And is about looking forward to 2016, when the world will be forced to confront the failure of the war on drugs at the UN General Assembly. This will hopefully be the opportunity we've been waiting to make sustainable change at the international level. This region is faced with one of the worst HIV epidemics in the world. This crisis is being driven by injecting drug use, and it is entirely preventable through vital steps, including cost-effective, evidence-based practices like methadone, needle exchange, and decriminalization of personal possession. If we want to help people, we mustn't even think of throwing them in jail. Decriminalization of drug use works, and so does harm reduction. In Romania, HIV treatment and care costs almost €6,000 per person per year. The cost of needle and syringe exchange is less than €500 per client per year. Harm reduction makes financial sense. Harm reduction saves lives. It is the right thing to do. Today, we are calling on our colleagues in business to join us in endorsing health interventions that will save hundreds of thousands of lives. Looking forward to joining forces so we can stop the war on drugs and introduce better lives for our communities. Thank you so much.